Very good evening from the evening clinic. Let's perform some illuminated medical tests to see what stage you're in. So I'm going to reach for the near vision chart first and ask you a few questions. Okay, so at this distance, on the green side, what's the smallest row that you can read down to? And what about on the red side? And just coming back here, is the print clearer on the red, the green, or about the same? And what about at this distance, please? That's about equal, good. Let me take some written notes tonight. So illuminated near chart, duochrome equal, and vision right, and vision left. Okay, we're going to reach for the retinoscope now. I'm going to be looking at the ocular media, the red reflex, sure that's intact. Just to ensure, as you're looking into the distance, that there's no scissor reflex, any meridian there. Okay, just look off behind me again. Have a look through the lens. Nice red retinal glow. No signs of any media opacities. And I believe there's no evidence of any scissor reflex there. Just have to check in various meridians. That's very good. So it's just a quick check using the retinoscope. It's not to be confused with ophthalmoscopy, which we'll perform later. And I'm just going to draw the diagram there to indicate no pathology. Okay, now this next light is quite bright. I'm going to hold it from the lateral sides. Just checking the anterior chamber. So I'd like you to look towards me. Okay, and the shadow created against the iris there is going to allow me to judge the depth of the angle there, the openness of the angle. Just keep relaxing. I'll do that on the temporal side. And the temporal side from your left. Just look towards me. Okay, so I've quite a big shadow there, judging the ratio. A little bit more there, good. Looks as though we have a nice wide angle there, temporal side right and left. Okay, so that was the shadow test. Right eye, temporal left, temporal, greater than grade 4 right, greater than grade 4 on your left. think I'll use the same light to check the pupil responses. Okay, now look off into the distance again. First up, the ipsilateral left consensual, and left ipsilateral, and the right consensual. And I'm just going to swing the light now from eye to eye. No evidence of a relative afferent pupillary defect. Okay, so pupils, ipsilateral, present right and left, consensual present right and left. Pupil sizes appear equal at about 8 millimeters without light. Negative RAPD there. Okay, I want to check your ocular movements. I would like you to look towards the green light, keep the head steady. Just follow with your eyes. So that's the horizontal, excellent, and the vertical. And just into the quadrants here. You following? Okay, just follow the light closer towards the nose. Okay, that's motility. Switch to the yellow light. Okay, all you need to do is look at the light now. It's looking at the corneal reflexes. A displacement of the light reflex could indicate a squint. And just looking through the window there, just to confirm. I don't believe we have any signs of a displacement of the light. Okay, so ocular motility first. With the red free light, full and smooth. No problems with the light reflex against the cornea. And then we did the Hirschberg test. Symmetrical reflexes there. Okay, I want to just have a look at the lids, lashes of each eye, up close with the illuminated magnifier here. So just look back at me through the glass. And now look down, upper lashes, look up, lower lashes. Excellent. I don't think there's any signs of blepharitis. No trichiasis, no poliosis on the right. And for your left, look down please. Now look up to the ceiling. lashes, good. Okay, now I want you to look up again. I want to have a look at the conjunctival surface. Inferior zone. Ensuring there's no redness or lesions. I look to the right. I look to the left. Okay, look up again for your left. Inferior conjunctiva, grade 1 hyperemia. Look right. And look left. Just slight yellowing on the nasal zone there, indicating very early pinguecular changes. Hyperemia grade 1. In those 3 zones, right and left. Excellent. Okay, lids and lashes. No signs of blepharitis. Conjunctival hyperemia, grade 1 right and left. Left eye, nasal conjunctiva, slight yellowing, indicating early pinguecula. So please ensure that you protect your eyes from the ultraviolet light as much as possible by either keeping out of direct sunlight or using good quality sunglasses to reduce the ultraviolet exposure to the ocular surface there. Lovely. I think we should have a look at your eyes with the Burton lamp using the blue light. Okay, just look up. I'm going to place a little bit of dye into the eye there and a little bit onto the left. We're going to use the Burton lamp now with the blue light. Okay, just want you to look through this window. And I'm just reviewing the corneal surface. I would like you to blink and stare now. Okay, just checking the invasive tear breakup time. Now blink normally. 5 zones of the cornea there. Looking relatively clear. Okay, and a few normal ripples on the conjunctiva, grade 1. But the cornea is looking clear, no staining. Okay, and for the left, just blink again. Okay, I just want you to look up, right and left. There's a single punctate spot, the inferior zone of the cornea. Just blink and stare now. 3, 4, 5, 6, 7, 8, 9, 10, 11. And now blink normally. It's just a superficial bit of staining there on the cornea, nothing to worry about. Okay, let's take some notes. So that's corneal and conjunctival staining. Using the Burton lamp, right clear cornea, grade 1 conjunctival staining. Left single punctate spot at 6 o'clock near the limbus, superficial. Conjunctival grading look on the left, grade 1 normal ripple effect. Okay, we'll just wrap things up with a little bit of ophthalmoscopy. Okay, look off into the distance. Let's have a look at the optic nerve on the right eye. I have to come quite close for this. Okay, take a blink. Look over my shoulder. And we have a nice defined optic nerve, pink. Now crowding, medium size, vessels clear at the margins. Evidence of any pits. Look over my left shoulder now, please. Let's have a look at your left nerve. And blink. Good quality optic nerve there. No signs of any pathology. Pink colour, defined margins. A little bit of a choroidal crescent on the temporal side there. Nothing unusual. No signs of any PPA. Just look into the light now. Just check the macula. And into the light again, please. Left macula. It's clear, flat, foveal light reflex. Once more this eye. And once more this eye. Excellent. I think that's just about everything. Let's take some final notes. 0.5 cupping right and left. Defined discs, maculae clear, vessels clear at the disc margins. Nice pink hue. Just that slight choroidal crescent on the left eye. Just to illustrate that. No signs of any peripapillary atrophy. Okay, so for all the written notes there, everything is looking quite good. I'm quite happy. So I'd like to see you again in 2 years' time, just to review the situation. But if anything gets worse in the meantime, just call us up and I'll review you again. Thank you.